When we normally develop a vaccine, we're talking about a process that takes from 7 to 10 years. We're now in phase 1, which is the very first time testing of the vaccine in humans, and we are going to compress that process into a period of a little bit under a year. So it is an incredibly accelerated process. In order for the vaccine to be used, we have to have data on its safety and its efficacy, and those data will not be available before the end of 2015. At the same time, we have to be able to manufacture the vaccine at doses that would be consistent with general use, and that's going to take well into 2016 to be able to do that. So unfortunately, it's not going to be as quickly as we would like.
So will this be the answer to this outbreak?
I don't think this vaccine should be seen as the primary answer to this particular outbreak, but we certainly hope that this vaccine could be used to prevent future outbreaks. I mean, in retrospect, we should have pulled the trigger earlier, but I don't want to point the finger at anybody because we were all using our best senses about what to do, what was the right place to put our resources, and certainly the approach that the WHO has used to control many of the previous 20 or so outbreaks were very successful, and I think that they did the right thing to try and control it locally on the ground.
And when you see how it's developing and the spread of it in West Africa, what do you make of that? Does it worry you?
I worry that the epidemic curve that we've seen over the last month and a half suggests that the incidence of this infection is not dropping. The number of cases is doubling about every 3 weeks. And if there isn't something that is going to control that epidemic curve, the potential for spread of this virus into the surrounding countries is quite real.